Hello, and welcome to the Community Health Training Institute's 2018-2019 overview. My name is Gina Rodriguez, and I'm going to be walking you through this presentation that will share who we are here at the Training Institute, what we do, our new training calendar, and also some really cool opportunities that we have to offer. So why don't we get started? Here at the Training Institute, we have two key partners, the Massachusetts Department of Public Health and Health Resources in Action. Our project is funded by the Massachusetts Department of Public Health, and thanks to their generous funding, all the trainings that we offer are absolutely free. The Training Institute is a project housed within Health Resources in Action, which is a public health organization in Boston, Massachusetts. Here at Health Resources in Action, we are a leader in developing programs that advance public health and medical research. So who are we? Here at the Community Health Training Institute, we are a training institute. We host a number of trainings all throughout the year with topics focused on community health and public health. Also important to note that all of our trainings are geared towards and targeted to Massachusetts coalitions and community groups. Our goal here at the Training Institute is to provide targeted skill development in coalition building, leadership, policies and systems change, communications, health equity, youth development, strategic planning, evaluation, and so much more. When we go over our training calendar a little later in the presentation, you'll see these topics come up again. The Training Institute is led by a small but mighty team. Daisy Ortega serves as our project director. Myself, Gina Rodriguez, I serve as the project manager, and Kelly Dankert serves as our events and communications coordinator. The Community Health Training Institute also hosts the only searchable coalition database in Massachusetts, and it's full of some great information. Our database, or Coalition Finder, houses information for 414 different coalitions across the state. And here is our breakdown by region. You might be asking yourself, well, how do I know if my community group is a coalition? And that's a great question. We go by the Massachusetts Department of Public Health Coalition Guidelines and Principles. You can find out more information on the DPH website and also on our website, hriainstitute.org. We'll also list them here. So if your coalition meets all of these guidelines and principles, then you're considered a coalition and you should definitely join our database. But if you wanted to learn more information or build your skills around specific guidelines and principles, so for example, around defining your leadership or building a membership that is reflective of your community, you would attend our coalition building training, which will address these specific guidelines and principles. Now here's a tip. When you're on our website and you're looking through all the trainings, you'll not only find the training description and objectives, but also at the bottom of each training page, you'll notice which guidelines and principles will be addressed at each training. And while you're there, we ask you to join our roster. Visit hriainstitute.org/coalitions and find out if your group or coalition is already on our roster. If you are, make sure that your information is up to date. All of the information that we have on our database is self-reported. So it's up to you to make sure that all your contact information is up to date so that you can connect with other coalitions across the state and be a part of our network. As mentioned, we host so many different trainings throughout the year, and all of our trainings are led by experienced facilitators who are content experts in their field. Our trainers come from different public health and nonprofit organizations across the state of Massachusetts. This is just a small sampling of who will be engaging this year. So why don't we get into our training calendar? This is a list of all the public trainings that we'll be hosting this year, open to anyone in any coalition, community group, or the public that's interested in these training topics. We'll take them season by season, starting with fall. We're opening up our training calendar with an online training entitled, What are ACOs and how can they meaningfully address the social determinants of health? This online training will cover the history of health reform in Massachusetts and how accountable care organizations, or ACOs for short, are helping coordinate care for constituents across the Commonwealth. Our first in-person training is called Implementing a Health in All Policies Approach. Now, this training will be covering a basic health in all policies framework. We'll also be delving into some strategies on implementation of that framework and where your coalition fits in the health in all policies approach. And then rounding out our fall, we'll also be introducing an in-person training entitled How to Run Effective Meetings. Now, this training will be going into some interactive training techniques and how to incorporate different learning styles and help you build better training and meeting agendas. Now, let's jump right into winter. Because we are based in Massachusetts, we recognize that winter can be a tough time to get around with the snow and the weather. And so you'll notice that most of these trainings this winter are online trainings. And we're starting that off with preparing your community for policy change. What to expect at municipal and city meetings. Have you ever tried to engage community members or coalition members in city council meetings or some town hall meetings? Well, this online training will help you talk about what those community members can expect in those meetings and how to prepare them for being a part of those meetings. We're also really excited to introduce Trends in Public Health roundtable discussions. This will be some roundtable discussions where we'll be engaging different topics focused on trends in public health and engaging different coalitions from our coalition roster. We have topics that we're exploring, so please stay tuned to our website where you can find out once we list those topics what they are and also which coalitions we're going to be engaging as thought leaders in these discussions. Another online training we have coming up is prioritizing youth voice in public health efforts. How you can engage young people in your public health efforts and making sure that you're engaging them in meaningful and powerful ways. We also have using data for program evaluation. What can our programs do with all the data that we collect, and how can we use that data to inform program efforts in the future? And then rounding out our winter, we have another online training entitled Content Planning for Social Media, Tips, Tools, and Overcoming Barriers. This is the third iteration of our communication training series, and this training, online training, will be going over how to engage your audience across all different platforms. Jumping into spring, we'll also have some trends in public health roundtable discussions in the spring as well. So again, stay tuned to our website as we release that information on topics and coalitions that will be engaging around those topics. We'll also have an online training entitled Deconstructing Structural Racism, Examining History and Systems to Make Change. Now, this online training will be covering the history of health disparities and how to address inequalities in your community. We're following that with an in-person training entitled Health Equity and Cross-Sector Partnerships. This will talk about how stakeholders and communities can align for the promotion of health equity. We're also including another community organizing training this year entitled Community Organizing in Action, Mobilizing for Change. In this in-person training, you'll learn skills about power mapping and goal-oriented campaigns. And then closing out our spring calendar for our public trainings, we have coalition buy-in, how to get your community and stakeholders behind you. This in-person training will talk about engaging and retaining key stakeholders. We'll be doing some case studies and scenarios and really talk about problem solving in the coalition field. Now that was our public training calendar, meaning any coalition member, community member, or member of the public that's interested in any of those training topics can go on our website, register for the training, and attend absolutely free. This year, we also have a new aspect of the Training Institute that we're calling the Health Equity Cohort. This is in response to some positive feedback that we've gotten about our different health equity trainings and how our training attendees want to be more involved and do a deeper dive in the health equity work. What do we mean by cohort? Well, here at the Training Institute, our Health Equity Cohort will be a network that connects public health workers and coalition leaders across the state to promote health equity in their communities. You'll be attending a series of trainings as a cohort together, build a network, and again, you'll do a deeper dive into the health equity field and how you can transition those skills that you learn into the work that you're doing. The cohort structure will consist of 3 different trainings. We'll kick it off with structural racism in March 2019. That'll be an in-person training. Our second training will be moving from the social determinants of health to health equity. That'll be an online training in April 2019. And then our third and last training will be racial equity, an in-person training in April 2019 as well. And in addition to those 3 trainings, we'll have some networking and connection opportunities that are happening all throughout the cohort. We'll also be bringing back Mo Barboza from Health Resources in Action and Lori Lobenstein from Design Studio for Social Intervention. They've led our health equity trainings and series over the last couple of years, and we're really excited to bring them back as they have a whole wealth of knowledge in this area and are really excited to be leading this cohort for us. So does this sound like something you want to be a part of? Well, we hope that you will apply as soon as applications open up in September. We're looking for 30 professionals dedicated to promoting health equity in their community and committed to attending all 3 of our trainings in the cohort and participating in the networking opportunities that will happen in between. So again, be on the lookout. Applications will be released in September. And again, they're open to the community, coalition members, anyone who's interested in being a part of our health equity cohort. So we've gone over our public training calendar. We've shared our new and exciting health equity cohort. What else do we have to offer here at the Community Health Training Institute? We have some great additional resources. We have a new resource page on our website. We have our monthly newsletter that has a whole wealth of information, and our blog. The new resource library features 6 new pages on topics like health equity, coalition building, and using data, and a few more topics. You'll notice a small screenshot of what it looks like here. Now, each one of these pages hosts and has a whole list of resources, links, toolkits specifically curated for you guys, for coalitions and community members in Massachusetts, and resources we think will be helpful and useful to the work that you're doing across the state. We gather this information from local and national public health associations, other public health newsletters that has information we think will be useful to you in your work. So please visit our new resource library so that you can take a look at what's available. We also have our monthly newsletters. What you can find in our newsletters are some training updates, opportunities from the Massachusetts Department of Public Health, community health news locally and nationally. What's happening in the public health world and how is it affecting the work that we're doing? We include grant and funding opportunities available in Massachusetts, job postings, curated resources and toolkits, again, specific for you. Not only are we updating our own training updates and what's happening in our training calendar and our new cohort, but we also have a host of different partners across the state of Massachusetts that we list their trainings as well, and information from other training institutes and other providers that provide resources we think are useful for your work. We're proud of the work that we've been able to do here at the Training Institute. Last year, we were able to host 16 different trainings. We had 50 hours of active training time, and we had a 4.4 average evaluation score out of 5. We train nearly 400 different coalition leaders, community members, and others working in public health, and we want to continue to build that number, so please join us. We engaged 11 different trainers from organizations like the Massachusetts Municipal Association, the Massachusetts Public Health Association, and Boston Alliance for Community Health. Last year, we were able to share 69 different resources, 48 different news articles, 125 trainings, and 156 funding and job opportunities via our newsletter that reaches over 3,000 people. So if you haven't already, please join our mailing list. You don't want to miss out on all the information that we offer that we spend time really thinking about what will be engaging for our audience. And also, we're really proud to share that we grew our Twitter following by over 100 followers. We've been able to participate in different public health and trending Twitter conversations, and we've been able to hear from you as well. You tweet us and connect with us after you've gone to our trainings, after you've connected with some really great information on our website. So please continue to tweet at us and follow us on Twitter. And speaking of Twitter and different ways that you can connect with us, here's our contact information. You can email us at traininginstitute@hria.org. You can visit our website, hriainstitute.org. You can help us continue to grow our Twitter following and follow us at HRIA Institute and join our LinkedIn group, Community Health Training Institute. I want to thank you so much for listening to this presentation, and we hope to see you at one of our trainings.